And as you all know, cerebrovascular diseases are important medical and socioeconomic issue in context of neurological diseases in our day, and they represent the first leading cause of physical impairment and the third leading cause of mortality worldwide. So by the definition, they include the brain aneurysms, that means the dilatation of blood vessels walls, which rupture leads to subarachnoid hemorrhage, which often requires urgent neurosurgical treatment. So all that may cause cognitive and executive functioning problems and emotional disorders. So with the advancement and development of neurosurgery, an increasing number of patients survive after the rupture and the ruptured aneurysm surgery. So there is an increasingly common occurrence of aneurysms in people under 60 years. But what we have to have in mind that they are still able to work and they play an important role in their families as well as in society. So it's very important to have the neuropsychological assessment and the neuropsychological rehabilitation. So we know that prevention, treatment, and rehabilitation of aneurysms are developing, but the question still remains, what are the long-term consequences of the quality of life of patients? So dysfunction can occur in all areas of their functioning, including cognition, emotion, and behavior. And after aneurysm surgery, most patients find it difficult to return to the preoperative level, the quantity of or quality of social relations, employment, or lifestyle, with only the third of them returning to the preoperative level of functioning. So multidisciplinary approach is crucial in recovery or rehabilitation. So it usually includes occupational therapists, physiotherapists, and psychologists. And it's possible to include a speech therapist, social worker, and psychiatrist if necessary. So in Croatia, neurorehabilitation is carried out in hospital wards within specialized rehabilitation institutions or in clinics, as well as in home care, and includes various methods. So although some cognitive deficits to some degree are present in all patients after surgery, for most can be expected to improve over time. The researchers suggest that fastest recovery is the first 6 months after subarachnoid hemorrhage and surgery. So some of the factors that can affect the speed and quality of recovery are type of lesion, location and extent of the lesion, previous injuries, age, premorbid intellectual status, gender, lateral dominance, and some personality traits. So at the beginning of neurorehabilitation, it is necessary to conduct a neuropsychological assessment, which includes clinical interview, anamnestic and heteroanamnestic data, reviewing medical records, and applying a large number of tests and techniques who are sensitive to different types and degrees of brain damage. And then we make a quantitative and qualitative analysis of the results and make some conclusions, taking into account the observation of patients' behavior too. So cognitive examination of cognitive functions include assessment of general intellectual ability, thinking, perception, memory and learning, spatial and constructional functions, expressive functions and communication, meaning language and speech, and executive functions. And assessment of personality changes and emotional changes is also part of neuropsychological assessment. The aim of this research was to examine characteristics of visual perception and retention, verbal memory and learning in patients after cerebral aneurysm surgery. And there were 2 research problems identified. First one, to identify possible deficits of visual perception and retention, numerical short-term and working memory, verbal mechanical memory, meaning they have to learn list of words in 5 trials. So this verbal mechanical learning and memory, we are interested in a learning capacity and learning curve, short-term and long-term memory, and verbological short-term memory or memory for stories as well. So the second problem was to examine the predictive contribution of demographic variables such as gender, age, and education, as well as localization and lateralization of aneurysms in the domain of visual perception, visual short-term memory, and long-term memory, as well as numerical and working memory, verbal mechanical short-term and long-term memory, and verbal logical short-term memory. So neuropsychological assessment was made during first 6 months after brain aneurysm surgery with a mean of 78, something more than 78 days. And it was made during last 10 years at the Department of Neurosurgery, Medical School University of Zagreb at Clinical Hospital Center Zagreb in Croatia. At the beginning, we had 135 patients, which the most of them were female, with mean age 51 years and the mean education about 12 years. The most of them were have had about 10 to 9 years, 12 years of education. The most of aneurysms were located on middle cerebral artery and anterior communicator artery, and about the same percentage in right or left hemisphere, with bilateral, meaning anterior communicator artery in 25%. From the big number of tests, we choose subtests from Wechsler memory scale, which measure numerical and verbal logical memory, audio-verbal learning test, and Ray complex figure test for visual perception and retention. So here you can see the results, descriptive data for visual perception and retention, and what can be seen that results indicated these statistically significant differences between the results of our sample and the test norms. As regards verbal memory functions, you can see here the results for numerical memory, working, verbal mechanical, and verbal logical memory. These Affiliation 1, 2, 3, 4, and 5 are 5 trials of memorizing 15 words. Then Affiliation 6 is short-term memory, and 7 is long-term memory. But only the results indicate the statistically significant difference with norms only for short-term verbal logical memory. So while in other types of verbal learning and memory, the respondents achieved the respective results in accordance with the norms. Well, when you see these results, what it means, when you go look at this statistically, it seems that what is average is normal and expected. But when you make neuropsychological assessment and do it individually, you can see that sometimes, and not so, I can say more often, that premorbid level is something we can't include in this kind of research. So when we do it, the program individually, when somebody has the results that is average, doesn't mean that this person hasn't got any deficit. So you have to have this in mind. So here is the learning curve of verbal mechanical memory. Down there you can see these 5 trials. So they have to learn 15 words. This green line is our norms, and this blue line are our subjects. So you can see that in every of these 5 points, they have a little bit lower results, but not statistically significant. So after that, we made some regression analysis according to get the answer to the second problem. When we, in the domain of visual perception, only years of education proved to be significant. And visual memory, immediate recall, or short-term memory, age, education, and lateralization were statistically significant predictors. We can see on this picture that this bilaterally situated aneurysms, that patients with bilaterally situated aneurysms had some lower, statistically significant lower results than those with aneurysms located in right or left hemisphere. For visual memory, delayed recall or long-term memory, age and lateralization proved to be statistically significant. Here you can see also that bilaterally situated aneurysms, patients with them had lower results on the long-term memory. Regression analysis for verbal memory tests the numbers are small, so you can't see them, but I just wanted to put them here, proved that gender and age were significant predictors for verbal mechanical memory capacity. That means for fifth trial of learning words, for short-term and long-term verbal mechanical memory, and years of education proved to be significant predictor of working memory, short-term and long-term verbal mechanical memory, and verbological short-term memory. And localization and lateralization of aneurysms have not been shown to be significant predictors for any type of verbal learning and memory. That is something that is different from visual. So to make some conclusions, for the first problem, the results indicate the existence of visual perception, visual memory, and verbological memory deficits, with participants achieving statistically significantly worse results compared to the norms. And for the second problem, in the domain of visual perception, education was the only statistically significant predictor. That means respondents with higher education achieved higher results. In the domain of short-term visual memory, age, education, and lateralization proved to be statistically significant predictors. So that means older subjects with lower education achieved statistically significantly worse results, and subjects with bilaterally located aneurysm achieved statistically significantly worse results than subjects with left hemisphere aneurysm. In the domain of long-term visual memory, age and lateralization proved to be statistically significant predictors. So that shows that younger subjects scored higher than older subjects, and subjects with bilaterally located aneurysm scored statistically significantly worse than subjects with a left cerebral aneurysm and right cerebral aneurysm. In the domain of verbal mechanical memory capacity, short-term and long-term verbal mechanical memory, gender and age proved to be significant predictors. So that means women and younger respondents achieved better results compared to men and older respondents. And at last, in the domain of working memory, short-term and long-term verbal mechanical memory, and verbological short-term memory, education proved to be significant predictor. So that means participants with higher education achieved better results on these tasks. So these are the results of these two studies that were carried out at the Department of Neurosurgery. So thank you for your attention.